Okay, so once you get the wound prepped, and when I say that, historically you're gonna take betadine and just paint the intact skin with betadine, and then you put your fence-rated drape over it. Now again, everything in here is sterile. Then you're able to reach into your kit and you'll have your lidocaine or marcaine, whatever you're using for anesthesia. Historically, you want to use a small gauge needle, either a 27 or a 30. For this particular incision, we're going to use a 27 gauge needle. A little trick when you're doing these is bending the needle a little bit because it's kind of hard to stick it in if it's straight. Another little trick is not to go in intact skin. You want to enter from the wound edge. So in this case, we're going to start on the wound edge and we'll advance it the length of the wound. And then as we slowly are injecting, we are then backing the wound, backing the needle out of the wound while we're injecting the anesthesia. With lidocaine, it'll kick in about a minute or two, and you can kind of see that starting to puff up a little bit. That's very normal. And then we withdraw, and then we would do the opposite side. Once you're completely happy with the anesthetizing of the wound, I usually will ask them to close their eyes and just kind of check and make sure, hey, can you feel this? Do you feel this? And check around the area where I'm gonna be suturing so that there's no surprises. If they still have a little sensation, you can always come in and just give a little injection into the area that may not be completely anesthetized as good as you want. Another little trick is using epinephrine for hemostasis. Of course, you don't want to use epinephrine on ears, nose, fingers, toes, or genitalia.